Good evening, everyone. This is Dr. Vignesh Kumar. Today, I just wanted to speak some few words about cognitive functional therapy on low back pain. It is chronic low back pain. As a question arises, whether this cognitive functional therapy is much better than other modes of exercises therapy and other treatment methods. Of course, it is not. But what is the difference between others? There are a lot of research which is going on, lot of trials which is going on when compared to the group exercises for back pain, when compared to manual therapy with back pain, when compared to stabilizing exercises with back pain. So lot more research which is going on with comparative study with cognitive functional therapy. So, cognitive functional therapy is basically a biopsychosocial approach, and it is working on basically a psychological issues and tissue pathology, and it is not completely, it is not a structural problem, the chronic pain, all the things which is outdated now, and how the patient, how they acquire all this issues which influences their body, and how they are restricting their functions. For example, avoiding the forward bending, not participating in regular works, plays, games, or goals which is not yet achieved. They kept ideal in the home. All those things which can be addressed in this cognitive functional therapy. So the difference between the other therapies, the trials which is going on and confirmed it, there are 12 months, even 1 year long standing after giving the cognitive functional therapy. The patient is getting relieved from catastrophizing pain and related to fear, anxiety, depression, lot more things which has been changed here. So all this enumerately gives the wonderful changes. So this is the important thing, that person become change and living back again to normal, participating again to normal, which is happening only in this cognitive functional therapy. So I am not addressing here other therapies are not good. We can try other therapies also, but we should use incorporate this high level evidence based cognitive functional therapy, because a lot of trials which is going on, lot of research work is going on, which shows an high level evidence there is a long standing effects on this chronic low back pain. So recurrences are very less here. So pain fear and increases the self efficacy for the patient, catastrophication, and patient will be easily to participate what they wanted to achieve as a goal. For example, regularly they are going to office, they take more absenteeism, sick leave, that has to be restored. They used to participate in gardening work, that will be restricted. Household chores, that is restricted here. So all those things which has been trained accordingly by means of giving a loading exercises, by means of educating them, don't get fear. So this is not nothing, so nothing will happen, all those things. Because chronic pain means we already know that beyond 6 months, beyond 1 year or years together, the patient living with the problems. So they restrict the movements, so they restrict the social participations. So that has to be restored by giving a wonderful education, wonderful tailor made exercises program according to their expectations. So we respect, we value, we giving priority according to what they needs, all these things which has been satisfied in this program. So that is the difference between other exercises programs, manual therapy or group exercises or stabilizing exercises or chiropractic. The cognitive functional therapy standing a unique role, having a higher level of evidences. And another important thing is pain neuroscience education, which is also currently great research work which is going in Australia by Lorimer Mosley, the team of Neuro Orthopedic Institute, a NOI group, which is in Australia, South Australia. They are doing lot of research works. Now the current research works on patients fatigue. So they are doing a research on anxiety, fear, and post stress related disorders. They are doing a wonderful research for this chronic pain is concerned. And what Lorimer Mosley is emphasizing mainly the pain which related to the fear, which shows more adamancy in the patient, and even learning educators also. So we should respect, we should give a value and check out the vulnerabilities, what are all the important constraints, why they are not doing the regular activities, why they are giving a protective mechanism in the brain, how the pain which is activating, what is the neurophysiology which is happening, all those things he is emphasizing. That is an important research which is going on. They are doing a lot of webinar works in pain neuroscience education. So that emphasizes more on stress and anxiety, physical activity. People who are inactive, encourage them to do a little bit graded pacing activities, to do basic walking, cycling in a graded manner to reback normally, and whatever the thing that we have to encourage the physical activity exercises also for this type of a patient. And diet as well as nutritions are very important. The diet is concerned, low fiber, low carb diets, not processed foods should be used, and sleep hygiene and stress relieving by doing a mind body, especially mindfulness meditation. All this are grouply compounds a pain neuroscience education. So pain neuroscience education and CFT, cognitive functional therapy by Peter Sullivan, so both are doing a fabulous work in chronic low back pain. So now they are authority in Australia. So it's spreading worldwide. Why don't we incorporate in India, in Tamil Nadu, and utilize it for the patients suffering with chronic low back pain, chronic fibromyalgia, chronic neck pain, for all the things that we can use biopsychosocial model approach. Thank you. And I think this is a door opening for all to learn what is this approach. Thank you, one and all. Have a great day.